This is Bridging Health Care, and I am your host, Bridget. Thank you for joining me on this channel. The main focus is helping us to become highly effective healthcare worker, bringing informative, educative solutions to our world. I am so happy you're here. Sit down, relax, like, share, subscribe. Thank you. Hello guys, and welcome to my channel. This is Bridget from Bridging Healthcare. How have you been? And how has been work for those of us that are already healthcare professionals? And how is preparation for those of us that are looking to go into the field? Those of us that are in school, those of us that are waiting to write an interview or something. How have you been? Well, the world is not waiting for nobody, and healthcare is booming and getting more and more interesting. So for those of us that are looking for a switch, healthcare is the real deal. Why? Because you'll be making impact in people's life for real. You are going to be affecting people's life for real. And that is why you need to take it seriously. So today, drum rolls, I have something really interesting to discuss with us. As a means of charge, I want to encourage everyone out there, don't give up on your dreams. Don't give up on your dreams. If you really want to do this, pursue it with all that you've got. And let me tell you, it is highly rewarding. Health and social care is rewarding. And there are so many departments that you can work in. And there is growth pathway. So don't just think that you start there and you stop there. No, you can always grow. Now to the meat of the matter. Today we're going to be discussing preparing for an interview. That's, you have gone through your program, you are done with the course, you have your diploma, you've got some experience, and now you've got a job opportunity and you've got an interview. So what are the things to expect? In this video, we're going to talk about what to expect, how to prepare, possible questions that you may be getting, and how to answer those questions. Remember, you have your certificate and all that, but healthcare is hands-on, it's person to person. So it's not something that you do online. It's a job that you meet with the client one-on-one. And that is why the organization needs to meet you, to do an interview with you, and to see how well you are into this profession. So let's discuss. Now, you know that you need to do your program, right? You need to take a course. It's good to study. Study to show thyself approved, a workman that need not be ashamed. That's what the Holy Book says. So you need to study, you need to get a certification, you need to be qualified. And after that, you also need some experience. So while you are studying, you can also get some experience. How can you get experience? You can volunteer in a care home. You can volunteer in a hospital. You can volunteer to care for some people and let your job be seen, like you're showing up every day. I always advise minimum of 200 hours so that you have, what you have done for 200 hours, you would have seen different types of what can happen, what situation can happen, and you've been able to be part of a solution and you're able to make impact in somebody's life within 200 hours. Okay, so get some experience. After that, you can prepare your CV depending on where you want to work. Every organization and every country have the kind of CV packaging that they want. So if you want to work in Africa, there's a way Africa CVs are. There's a way the Americas are. There's a way the Europe is. You need to research. Upload your LinkedIn. Go on LinkedIn and include all your new certification and show that this is what you do now. This is what you are. You are allowed to change your career path. So it's something that anybody is allowed to do, so you can do it. And after that is done, a company has contacted you, right? Congratulations. And now you've got an interview. So first things you need to do to prepare for the interview. Jot down the exact timing for the interview and be on point at least 10 minutes before the interview. If it's a physical one-on-one, you have to be there at least 10 minutes before the interview just to calm your nerves. And if it is online, you have to clock in at least 10 minutes before the interview starts. That way, it shows that you're really serious, right? The next thing is be prepared. Don't just go to an interview looking all shabby. When I got my own job offer and the interview, because I was working as a nurse in a hospital at the time, and I just booked my interview time to my break time at work. So I was all in my scrub, and that day I chose one of my most beautiful scrub, and I was looking all fancy and fine. So if you're gonna dress up, make sure you cover up. Don't leave any plunge line. Don't leave any cleavages. I mean, it's a job. It's a professional offer you're going for. So you're not going for a fashion parade. That's not the day to do so much makeup that you're all glossed up. Because when you start working as a healthcare professional, let me tell you something. You won't really need the makeup. You might just need the basic, just simple. That's why you see, even most of my videos, I really don't believe in doing all this painting, even though I'm talking to everybody in the world. The truth is that in this profession, you don't need long nails. It's not even healthy. It's not allowed. You need to trim your nails. Your nails must be trimmed. You don't need too much of jewelry, because if your jewelry is hanging down and you're trying to help a client with personal care or something, and it's thronging all over, infection and everything can be transferred. And you don't even need long hair. If I'm going to work, my hair is all tied together. I always ensure that my hair is tied together, or I have something short on. So dress professionally. Does not mean that you should look all shabby. Just dress professionally. I've told you to get there on time. Dress professionally. Breathe. Relax. Don't rush down from somewhere and then rush into the interview. No. Relax. Get yourself together. Tell yourself, I've got this. This one, I'm going to do very well. You have to be positive. You have to speak positive to yourself, because you know what? You've done your best and you love what you do. You've got passion. The question they're going to ask you are not from they are not from another planet. They are everywhere, and which we're going to be discussing today. Also, you also need to know that the people that are interviewing you are human beings like you, and they pick vibes from you. So if you are scared, they will pick it. So if something happens to a client, is this how you're going to be panicking? Because as a healthcare professional, you must always be balanced. You must always, if you want to understand what I just said, look at some of my previous videos. You must always be at peace with yourself. You must always be at ease as well. Don't think that anything is don't expect bad, and always be relaxed. Before you respond to things, calm down. So they need to see that you are very calm and collected, because they're looking at the body language as well as they're looking at what you say and what you represent. Now, having said that, you have all the documents that you need for your interview. Get everything together. If it's an online interview, have a solid internet service. Have 2 phones. If you're using phones, if you have a laptop and a phone on the side. Let me tell you something that happened during my interview. So during my interview was an online interview, and I was sat in with the laptop. I prepared to use my laptop, but I had my phone on standby. So once the interview started and I was really talking and, wowing all the people that were interviewing me and all that, it was like a 3-man interview. And poof, just a few minutes to the end of the interview, my network went bad. Instantly, I picked my phone and I connected with my phone. And once I connected with my phone, they were waiting for me. So imagine I was panicking. Oh, what am I going to do? So have your plan A, your plan B, if possible, to Z. So that if anything happens, you have it covered. Make sure that you have stable lights, like good lighting, okay? If it is online, if it is offline, all those things are sorted, yeah? Now, let's go to the kind of questions that you can be asked in an interview. First thing they might ask you is, how do you see the future of healthcare? Do you think that healthcare, they would just ask you a general question like that, and that's after you've done all your introductions, who you are, and don't talk too much. I have 20 children. No. Just introduce yourself. It is you that they need at the job. So if they ask you what is the future of healthcare, of course, you know that healthcare is a growing field and it's evolving. So always remember to use the right terms. Healthcare is a very evolving, field. where so many new innovative ideas are coming up that are making the work easy. And that is why everybody in the healthcare sector must keep themselves up to date and up to speed on what is going on in the world. There are so many surgeries that were done before that can't be done now. Before, you have to go to the hospital to get an appointment, but now you can do a tele-appointment. So healthcare is changing and is improving, and there is a lot of grounds to cover. You don't need to talk too much. You have already indicated that healthcare has improved, and there's still further opportunity for healthcare, and it's showing that progress. Now they can ask you a question like, tell me about yourself. Now, when they ask you, tell me about yourself, you don't have to tell them, just give them the relevance. My name is Bridget Ezobiako. I have a degree in this, that. I have passion for. I love to, and always take it back to the job. I love to make people happy. I enjoy seeing that people are satisfied and comfortable in their own space. And I'm just a support person. When somebody is happy about their care given, about what they need is given to them, and they're satisfied, I feel fulfilled. You see, you're beginning to take it from the client's perspective to yourself, and you're talking about yourself. So always talk about, I always have an inclination to help people. That's why my first job is this. That's why I took some time off work to go and take care of my grandmother when she was ill. Always just come up with things that shows that you are very exceptional. Now they can ask you, how do you stay informed with current healthcare advancements? So you say you're given to study, you love to read journals, you enjoy watching news, and you want to get information about what is happening in the politics as regards to health. And are there new innovative ideas, and you like to try and implement it so you do continuing education. You just finished this program and you're considering doing this, and you like to take part in medical conferences. You need to just come up with things that are very interesting. And they'll just be like, just what, like when the coronavirus came in, I did this, I did some study, and I even volunteered in some places. You're just painting yourself really good. That's what you need to do in a very humble way. Then the other things they can ask you is, what are your career goals? So of course, you don't just want to be in this level for forever. So you can say, I'm considering doing my master's along healthcare. Don't say, I'm thinking of doing law when you are looking for a healthcare job. So I'm considering having a master's degree in this, that. You must always remember the line of work. Do you understand? You must have studied your company and say and find a way to relate it to how you can solve the problems that the company is going through. Then they can ask you, what made you interested in working with us? Because you have had a study of the company, you can say, I have interest in domiciliary care, and I understand that this organization is very big on domiciliary care because it makes you go to meet the client in their space where they are comfortable. You see, you can also say that I also understand that this company has a lot of clients that are end-of-life care clients, and it's my dream to become an end-of-life care specialist where I work with people that are towards the end of their life, and I'm part of the team that they see that make them satisfied, that make them, and I want to be able to bring this beautiful aspect of me to an organization that is growing, that is forward looking, that is this, that is that. The company will be shaking. You will see them shaking their head like this. You see them shaking their head so always paint the company very good. They can ask you, what kind of care does an elderly patient need? So that is where what you have studied comes into play. Remember, your elderly people, most of them are either suffering a disease, a condition, or they are slow, or they are not able to recollect things. Maybe they have dementia, whatever it is, they're blind, or their hearing is poor, or they're suffering one thing or the other, or mobility is poor. So that basically what they need is support, and support is huge. So supporting them in terms of their medication, prompting medication, in terms of mobility, assisting to get up. If the person is immobile, assisting to move them to from one place to the other, either using the wheelchair or using the hoist and all that, assisting them to prepare their meals, assisting with incontinence aid and all that. So those are some of the things that you can respond. They can also ask you, Have you ever encountered a patient that you couldn't communicate with, and how did you manage the situation? I mean, you need to just blow yourself up here. I mean, information is key. Communication is important in every aspect of health and social care, and you know that every client is very unique. And you remember in one situation, come up with a story, or if it's something that's happened to you. I remember in one situation, I had a client who couldn't understand English and I couldn't understand her language, and I really wanted to help her. So what I did was, before I went to this client, I took my time to study the client. I checked the client's care plan, and I understood that this client does not understand. So I watched a few videos on basic language like hello, hi. Like, let me tell you, for instance, I don't speak Indian. I don't speak Gujarati, but I have a lot of clients that are Gujarati people that are Indian. So what I do is I like to watch a lot of their movies, or I just go on YouTube and check what is thank you. And you know, it says thank you is shukriya. And I say, okay, what do you call an elderly blah, blah, blah? I say, call her mercy. So when I get there and, you know, you're already flowing, the client is happy. So you tell them, okay, this is what I did, this is what I did. If you don't have those experiences, I had to get an intermediary, somebody who can translate for me. And I also was open to learning their language, you know, so this alone will stand you out. Let me give you two more. They ask you that you're about to give a client a bad news. What are you going to say? Maybe you worked with a client overnight and the client did not wake up and you want to call their family and all that. When a bad news occurs, and maybe somebody passed on, the first person you will ring is your office. You will call the ambulance, of course, because you cannot pronounce the person dead if you're a healthcare professional. It's only the doctor that pronounces the person dead. So you can't say, oh, this person has passed on. No, you will call the ambulance. You will do what you need to do as a person. So if you are authorized to do CPR, you do CPR. If you're authorized to give the person, make the person comfortable, you do that. Then you call the emergency unit, and once you've called the emergency unit, you ring the office immediately and you tell them this is the situation. Now they are now going to come up, except your organization has a lay down rule that you need to call the family and all that, you know. So always follow the protocol. So if maybe the office says call the family, of which most of the time they won't say that, but they say call the family. How do you break down the news? You have to, the person you're going to break down the news to, you have to make the person very comfortable, relaxed, and then you can now start sharing and you can explain, showing that you're very empathetic, and just don't drop the bad news just like that. You know, the more you answer these questions, you find out that you are even more confident and you are comfortable. And you know, they ask you, what is your biggest weakness? Please don't say that you don't have weakness, because nobody is perfect. A lot of people say, I don't have any weakness. Always speak your strength by shrouding this in weakness. Say, well, one of my biggest weaknesses is that I care too much. Once I give my heart to something, I don't want to stop. And sometimes I just tell myself, stop. But, you know, passion drives me. You see, passion drives me. So if a client, even though I know that I'm not supposed to, I'm supposed to end my shift at so and so time, and my client really is not ready for me to go, and the other person has not come to take over, or the person has come to take over, but my client needs me a little more, I make that sacrifice. I make that sacrifice because I want to see my client very comfortable. It's your weakness, but it's also your strength. So I hope this little video has been able to help us to understand how we can ace an interview. Because once you have presented yourself like that, they have seen you, that's what they will take now. They will now take your certifications and all that and pair it up with the person they have met. And please, after you have done all that in your interview, don't get on the job and go downside. Be who you have said you are. Be true to that person, you know. And I thank God there's a testimony in my company that it's just been the same from the beginning, the same excitement. You still present that every single day. And that is what everyone wants to see. That's what every employer wants to see. So I want to congratulate you again for getting that interview. And let me know how your interview went. You know, I know you're gonna ace it. Thank you so much for always coming back to this channel. I hope that you enjoyed this video and you keep watching it over and over again to help yourself, right? This is Bridging Healthcare and my name is Bridget Ezobiako. Don't forget to like, subscribe, and share. See you next time. Bye.